and I'll go through some issues. But basically, to tell you how we did the budget is terribly. And let me go through some details about how terrible happened and what we've done since then. In the beginning, the best information I had is we were operating at about a $5 or $6 million annual loss. Turns out when the audit came in, it was a $7.1 million 6-month loss, which would have been, of course, over $14 million annually. In addition to the operating loss, by operating loss I mean money coming to the hospital, subtract the expenses, that's your operating loss or gain. Non-operating losses and gains are things like the pension. And like the rest of the world, our pension fund went in the tank. A $50 million fund dropped to $40 million, and so we posted a $10 million loss. That's horrible and scary, but it's actually not as worrisome because you don't have to spend that. The market can recover, and thankfully has somewhat. But it's important to book it when you know that that's the case. So the good news is, here in the end of August, we are projecting an operating loss for the year of $7.5 million, which is $400,000 to the negative, but compared to $7.1 million over 6 months, $400,000 over 6 months is a substantial improvement. And we went from $1.2 million a month loss to a lot less. And also the pension fund has recovered in the market. It's $3, $4, $5 million better depending on what day or week you look at the market, and we won't know until the year ends on September 30th how to book that. So what went wrong? There were a whole bunch of internal factors, things we controlled, that were not done well. There was very poor planning, decision-making, and fiscal discipline in preparing that budget. We had inadequate reserves for bad events. We also had no line of credit, and of course when all of this happened, nobody was giving out any credit, so we had no way to go to a bank and ask for credit. We were not charging and collecting for everything we do. We've been giving away services by not adequately recording them and then collecting for them. So we overused temporary clinical staff. Temporary staff, locum tenens, temporary workers cost in healthcare anyway about twice per hour, week, month what a regular worker would cost. So. And then our physician practices did explode this year. We went from 40 to 60 physicians employed by the health system in the last year. Then, of course, this happened to us at our own doing in the middle of a world that fell apart financially. Our operating income went away, our investment income went away, patients had no insurance. It was not a pretty picture. So how did we respond? Well, there was a change in senior leadership, and a number of changes that I and others put in place in those first few months were, first, I did let 3 of the senior management positions go. I eliminated the positions and doubled their jobs up with other people. That was a 25% reduction in our senior team. Leadership has to take the first hits. You cannot go out to an organization and say, we expect you to give something up if we're not. We postponed all of our building projects. We eliminated all discretionary spending, travel, education, even celebrations. We don't have dinners to celebrate for people. 60 people lost their jobs. 30 other people had their hours significantly reduced in order to save money. So, and then we also hammered away at a lot of our contracts for purchase services and supplies. So we are tomorrow actually presenting in Montpelier our plan for achieving a $750,000 surplus in 2010. And then we know that the year after we must get back to operating years.
Common perception, one of the biggest worries that our patients have had is, if you're in financial trouble, it's going to affect my care. I can tell you that it's not. And that's why I showed you all of that quality data. There's an awful lot of process in a hospital that is not at the bedside. We had some staffing issues that were not being well managed. So, particularly as a physician, to me, it was critical in those first 6 weeks to take a very careful look, department by department, and focus the staff reductions on the place where the greatest waste and not at the bedside care.
So what does the staffing picture look like, or what are you looking to do, or where are we going? And were most of the 60 cuts in non-physician staff or in physician staff?
The cuts were almost all non-clinical people. There were some clinical people who were cut when there was overstaffing.
You said that you're at a $7.5 million operating loss. What's that in comparison to the overall budget?
That's a projection, by the way. The hard number is at the 6-month point. That's a 7.1. The budget this year was to have a margin of $5 million, so that's a $12 million swing. Compared to the margin at the end of this year, the operating margin will be a $7.5 million, $7 to $8 million loss, and we had budgeted to have a $5 million gain. That's the number I was comparing to. But that $7.5 million loss is on about $220 million of charges and $125 million of revenue in the door.
Are you concerned that with this, obviously very public discussion about the hospital's financial problems, that you will have trouble recruiting physicians?
A hospital, any organization that's a caring organization, will only function if we tell the truth. And it's very important to us that our patients understand where things are not going well and what we're going to do about it. And the same is true of the medical staff.
This is good. A nice crowd, and I think some good questions.
Mm-hmm. Do you think they were challenged at all?
In a peripheral way, but I don't think that a general meeting of this sort tends to provoke really provocative questions. They're not sufficiently informed. And I understand the awkwardness of the board of trustees, the directors, and this is characteristic of boards in general. They tend to follow the CEO as opposed to identifying themselves as contributors to the solutions. That's my comment, but I think it's true.